Dear students, our today topic is about evidence-based practice. Within the last few years, practitioners working in the education and treatment of persons with autism have been increasingly bombarded with training, articles, and presentations involving a concept referred to as evidence-based practice. The range of information and the many perspectives that are available on this topic can make it seem inaccessible or even impractical to many of the professionals who work each day in apply ways to improve the life of person with autism spectrum disorder. However, the concept is one that can fundamentally affect our applied practice in positive, measurable ways, and it is therefore ideal that practitioners may attempt to incorporate principles of evidence-based practice into everything they do, from identification to assessment to program planning to program implementation, etc. But what is evidence-based practice? The term evidence-based practice originated in the field of medicine in the early 1970. It was conceptualized as a method to minimize the gap between research and practice for primary care physician and became an essential component of medical education. This practice has extended into the field of education as part of the No Child Left Behind Act of 2001. It has subsequently become an integral part of evaluating the education and treatment of autism. This movement has continued to gain momentum in large part from the substantial increase in the prevalence of autism and to better inform practitioners as a means of promoting effective practice. There are effective practices in the education and treatment of autism that do not have enough empirical or science-based support to qualify as evidence-based practice. We must use our professional judgment to assess the efficacy of these tools and their use in the education of children with autism. But why is evidence-based practice important? Modern professionals work within an increasing range of ethical, legal, and practical constraints that at times seems as if they might strangle productivity and effectiveness. However, when pre-service or veteran professionals begin to consider these safeguards as constraints to their practice, it is recommended that they begin to look at such practice from the point of view of the consumer. Formulate personal principles of practice that are based on standards communicated by the wider community of professional colleagues, and review the origin and history underlying their conception. When professionals reorient themselves in this way, it can provide a renewed resolve to engage in the evaluation, incorporation, and implementation of practices that are considered to be evidence-based. In terms of consumer viewpoint, relevant areas for consideration can include time, financial resources, and efficiency. In terms of history, relevant areas can include the history of fraudulent autism spectrum disorder treatment and the formation of various legal considerations. Another important subtopic associated with evidence-based practice is pseudoscience and why some parents turn to it to treat their children. Perrine found that 28% of parents had used alternative treatment for their children with autism spectrum disorder, were more likely to seek out and use such treatment when disorder in addition to autism spectrum disorder were present. Whatever the true proportion of parents who seek out and use alternative treatment for autism spectrum disorder, the pressure for professionals to do likewise is immense and growing. As suggested by the finding of Perrine that I mentioned before, in 2012, the intense need for treatment created by the symptoms of autism spectrum disorder combined with other serious behavioral medical conditions seems to influence parents' treatment decision, as do other factors such as severity of disability or the child acceptance of the treatment, the marital status, and parent educational level. To continue with the same topic, however, it is also true that some other authors found that parents were most likely to stop using alternative treatment when they discover a lack of discernible positive change in the child. The picture painted by these studies seems to be one of parents' intense need and the resulting intense desire to find what will work in helping their children. The conclusion in this research was that parents to behave in ways that they believe are the most beneficial for their children. And in our free and democratic society, parents have the right to seek multiple opinions regarding treatment and to choose accordingly. Professionals have a primary obligation to do the following for their clients or students or patients: avoid harm, promote that which is likely to be the most helpful. In this graphic, you can understand how evidence-based practice is the integration of clinical expertise, the client perspective, the knowledge, the judgment, and critical reasoning acquired through your training and professional experience, the evidence external or external, the best available information gathered from the scientific literature, external evidence, from data and observation collected on your individual client, that is an internal evidence. The client, patient, caregiver perspective, the unique set of personal and cultural connections and cultural circumstance, values, priorities, and expectations identified by your client and the caregivers. Well, all evidence is not created equal, that we therefore should refrain from acting with the same intensity, frequency, and duration in response to all type of evidence. When we wish to examine a collection of evidence to determine its strength, validity, reliability, determining the type of evidence it embodies is a good way to begin. In conducting such an examination, it is often useful to think of the highest levels of evidence as the ultimate goal to be reached. Though it should be remembered that this is only one stage of a process for identifying an evidence-based practice. A community of professionals is essential in this evidence-based practice. Within using this evidence-based practice within professional practice has become an expectation in regard to protecting individuals with disabilities from harm and providing the best possible education and treatment to them. Should, in terms of evidence-based practice, do the following. Ethical responsibility, make treatment decisions that are fully informed from the research, literature, and indicative, data-based, systematic, and professional applications. Communicate to individuals and families evidence-based information regarding the effectiveness of specific treatments. Be clear about the known risk of alternative treatments, those not classified as evidence-based practice. To continue with this important topic, a community of professionals, important connections have been identified among teacher belief, sense of self-efficacy, emotional responses to challenges, and level of professionalism knowledge, suggesting that educators tend to be more effective and emotionally able to handle teaching students with autism and intellectual disability when their belief and knowledge are shaped by training and education in evidence-based practice. An adequate practice, an adequate training for teachers of children with autism has also been identified as one possible way to avoid burnout and reduce teacher attrition in the profession. And inadequate professional training can have the ultimate effect of limiting option and outcome for people with autism. Therefore, it is essential to remind ourselves that no one knows everything useful that there is to know, regardless of number of years of experience. Adopt an attitude of lifelong learning and professional growth, and identify personal and institutional training deficiency through maintenance of current knowledge regarding evidence-based practice, and ideally within the community of professionals, this process should be encouraged and implemented across all personnel, from administrative to service delivery. Most modern professions require service providers for people with disabilities to obtain some type or an extent of continuing education, and obtaining ongoing education throughout one's professional career is often tied to pay increase or the maintenance or certification, indicating the nearly universal importance placed on this activity. There is evidence that even a limited amount of professional development for educators can significantly increase knowledge of autism and evidence-based practice. And it is therefore recommended that the selection of topic for this education, both by seekers and providers, be guided by the current direction of evidence-based practice within one's field. To continue working with this point, we have now Sixth practice of professional skepticism. It is good professional practice to be skeptic or one who delays innovative action in favor of systematically gathering the best supporting evidence. In some social contexts, being a practicing skeptic can sabotage relationship and create doubt as to our sincerity and beneficence toward others. However, we do not confuse the often negative outcomes of being skeptical in our social relationships with the often rewarding practice of being a skeptic in our professional practice, even if others around us tend to confuse the two, especially in the field of education. There has often been a rush to embrace the fad of the day without first considering the potentially negative outcomes within an objective risk versus benefit analysis. It's relevant. Proceed with caution. With the information we find in internet about professionals or any article associated with autism or people with disability. Non-standard names is one of the caution we need to maintain. Consumer should be familiar with the way that professionals within a particular field of expertise discuss their own profession. Some of the terminology commonly used by this professional and how they publication most often characterize and refer to treatments and the common component of them. In short, it takes some research to find the standard names and definition of relevance. And one prominent example of the use of non-standard terminology that could signal the potential for problems is the use of the term ABA therapy to refer to the sign of applied behavioral analysis. If you observe as evidence articles that discuss, explain, or refer to research studies, and the studies themselves are not provide or no indication as given of where they may be found, this may be an indicator of intentional or unintentional misinformation. Treat information that for instance, refers to an article about a study as complete hearsay that is unique for evidence. Then proceed to find the real evidence for yourself. It means the primary source. It's certainly possible that a highly effective and innovative treatment can be discovered by only one person or organization, but how long might that treatment remain exclusive to the discoverer and completely unreplicated by others? Many large, highly funded, and well-equipped laboratories around the world are currently working on parallel projects in many fields of study. When a cure is found for any disability or debilitating disorder or disease, it will be well publicized and many others will rush to replicate it. Also, have the personal testimony in an infomercial ever inspire you to buy a product and any advertisement, and you then discover that the product was not as fantastic as was suggested? This is the danger of basing treatment decision solely on testimonials, although this is one level of evidence that should be given consideration among others. While the intent of the people making the testimonials may not be to mislead, and although the treatment may have seemed to be what improved things for some of the children or their family members, this is no substitute for wide, systematic, and replication. We have to clarify in this point the difference between alternative and emergent treatments. Emergent treatment have some scientific evidence, while alternative treatment lack a reliable evidence base. Continual review and replication by multiple researchers is crucial, especially given the current proliferation of treatment being suggested for use with people who have autism spectrum disorder. No matter how strongly a professional may feel in regard to the effectiveness of an alternative treatment, it should be remembered that a professional area of review is to know the current state of the relevant evidence base and to provide for individuals the most effective and efficient research-based treatment that are available. The choice to select and implement alternative treatments within legal and ethical boundaries, of course, falls squarely within the area of purview of parents, guardians, and conservators, for they assume the ultimate responsibility and risk for the livelihood of the family members potentially across their entire lives.